Okay, good morning, everybody, and welcome to SafeLink Alberta's Knowledge Thirsty Thursday. Today, we're going to do a presentation on HIV non-disclosure laws. My name is Chris McBain. I'm an educator with SafeLink Alberta. I'm a white settler here on the traditional territories of the Niitsitapi, the Siksika, the Piikani, the Kainai, as well as the Tsuut'ina and the Yahe Nakota, as well as members of the Métis Nation of Alberta Region 3. SafeLink Alberta is a small nonprofit. We're rooted in harm reduction, and we began in 1983 to serve people living with HIV. And while we have created programming to support key target populations most affected by HIV, such as members from African, Caribbean, and Black communities, Indigenous communities, and queer communities, our scope has expanded over the last 40 years. We also support people who use substances, sex workers, and our office in Medicine Hat provides support to persons of reproductive age as well. So our mission is to reduce the harm associated with sexual pleasure and substance use by offering low barrier and non-judgmental and informed programs and services. And it's our vision to create inclusive, empowered, and healthier communities. So I'm really excited that you are here today to join us. For our webinar today, Andre will facilitate the content and I'll monitor the Q&A function, which we tested out to make sure if it works. So feel free to ask any questions you have during the webinar. And at the end, I'll send a link to a survey that we'd love for you to fill out if you could. The work done by HIV Legal Network is funded in part by Public Health Agency of Canada, and this requires some data collection about the concrete impact that their public education work is doing. So your feedback would be greatly appreciated. So I'll introduce Andre. We have Andre Capretti with us from the HIV Legal Network to talk about the current HIV non-disclosure laws. Andre joined the HLN in October 2022 and has taken on a variety of work on a number of HIV-related human rights issues in relation to Indigenous people's harm reduction in the prison context and in different pieces of strategic litigation before being called to the bars in both Quebec and Ontario in 2020. He prepared for his career in law with judicial clerkship with Quebec's Human Rights Tribunal, and then articled with Amnesty International Canada, and has worked as a litigator for the federal government with a boutique litigation law firm in Montreal. He's volunteered with various legal clinics, student groups, and research institutes, and has spent time interning in Phnom Penh with a local human rights NGO, and Geneva with the Office of the United Nations High Commissioner for Human Rights. He holds a joint civil law and common law degree with a major in international human rights and development from McGill University, and has a master's in human rights and democratization from the Global Campus of Human Rights in Italy. So I think it's safe to say that our learning is in very competent hands today. Andre, it's so nice to meet you face to face. I'm just going to hopefully you have permission to share screen. And
thank you so much for that introduction, Chris. Yeah. I can go ahead and try sharing my screen. Oh no, it's disabled at the moment.
It should be ready now.
Okay. Can you see that?
Yes, we can.
Perfect. Let me start that. Okay, so it's really a pleasure for me to be here today to participate in your Knowledge Thirsty Thursdays webinars, and we're going to talk about HIV non-disclosure law. My name is Andre Capretti. As you've heard, I'm a policy analyst and a lawyer with the HIV Legal Network. So a bit more about who we are as an organization. As the name suggests, we work on issues relating to HIV, and specifically, we promote the human rights of people living with HIV or AIDS, as well as people and populations who are most affected by HIV. And we do that in a variety of different ways, through research, through litigation and advocacy, public education, like today's workshop. And we do that, importantly, both at an international level, but mostly in Canada at home. The Legal Network is based in Toronto, but I wanted to acknowledge that I am joining you today from Montreal, which is the traditional unceded land and territory of the Ganyan-Gahaga people. It's a place which has long served as a site of meeting and exchange amongst many First Nations, including the Kanien'kehá:ka of the Haudenosaunee Confederacy, the Huron-Wendat, the Abenaki, and the Anishinaabe. And of course, at the HIV Legal Network, we strive to do our part to address the ongoing injustice and resulting health inequities faced by Indigenous people in Canada, which contribute in particular to the disproportionate impact of the HIV epidemic on Indigenous communities. So let's start. Next slide. A bit of an agenda, an overview of the presentation today. We're going to start with a bit of context about HIV. Then we're going to get into some more basic overview of criminal law in general, get into kind of the history of HIV criminalization, and then look at the current state of the law, and following that up with impacts of criminalization, the harms of criminalization, and finishing up with a look at kind of the next steps, the law reform, which is on the horizon, as well as some action points for you to take home from this presentation. And I want to acknowledge as well that some of this material is hard to hear about and engage with. There will be discussions of HIV stigma, of criminalization generally, some discussion of sexual assault as well. It's also a very complicated subject matter. So please feel free to stop me to ask questions in the Q&A. If there's anything that requires clarification, I would be happy to address it. So for starters, context. There are currently over 60,000 people, more than 63,000 people living in Canada with HIV. Around 85% of those people are on treatment, and of those 85%, around 94% have a suppressed viral load. So HIV treatment is also called antiretroviral therapy. It's highly effective. It works essentially by suppressing the virus's ability to make copies of itself. And the number of copies of HIV in a person's blood is called their viral load. And then when people take HIV medication as prescribed, they see their doctor regularly, many people are able to lower their viral load to a level where there are fewer than 200 copies per milliliter of blood. And that's what we call a suppressed viral load. It's also what we call undetectable viral load. And for most people, this occurs roughly after 3 to 6 months of HIV treatment. Now, many of you may have heard there's a slogan that is used called undetectable equals untransmittable. So U equals U. And that's very important because essentially what it conveys is that a person with a suppressed or an undetectable viral load cannot sexually transmit HIV, even in circumstances where they have sex without a condom. And this has been demonstrated and proven by large-scale international studies, and that is where the science is at now, and that's super important. Now, I also want to highlight that there are many communities that are disproportionately affected by HIV in Canada, which includes, gay, bisexual, and other men who have sex with men, people who inject drugs, as well as Indigenous and Black communities, and even more specifically, Indigenous women, Black women, and women who inject drugs. Now, despite how much has really changed over the past 3 to 4 decades in terms of scientific knowledge, in terms of treatment options, there's still today a lot of stigma and discrimination that people living with HIV and AIDS face in all aspects of life, and that's hugely problematic. So now we're going to get into a bit of criminal law. I don't know how familiar people are with criminal law, so we're just going to do a bit of a refresher or look at some basic elements of the criminal law in Canada. So first of all, criminal offenses can be found in the Criminal Code, which is a federal law, which means it applies across Canada. Then it's also important to acknowledge or to understand that Canada is what's called a common law jurisdiction, at least in most provinces other than Quebec. But for criminal law, it's common law, which means that the law can evolve or develop through judicial decisions. So whenever a court renders a decision, that contributes to the development of the law. And essentially, future judges will be bound to follow what past judges have decided on similar cases with similar facts. So that is how the law develops in a common law. And here's a bit of a look, a very simplified look at how the criminal process works. What are some of the steps? Who are some of the actors? So essentially, you would start with a complaint from a complainant or a victim that would be brought to the police, who would decide whether or not to lay a criminal charge against the alleged perpetrator. Then, if that charge is laid, it moves to the prosecutor's office, so the Crown, and the Crown would then lead the prosecution in court. And then in court, there would be a whole trial, and that could eventually lead to a conviction, either by a judge or by a jury, and eventually sentencing potentially to prison time or to some other criminal sentence. I
On,
see that there are already some questions in the chat. I'll have a quick look at that.
so yeah, Mark wants to know what
Yeah.
happens when law is not keeping up or recognizing the science of today. That is a fine model for creating a law, but not for updating or changing a law.
That is a great question, Mark, and that's really the problem of criminalization today that I'll address later in the presentation. But I guess the overarching message for you all to take home already at this point is that the current state of the law around HIV criminalization is not in keeping with the science, and that is hugely problematic. And that's why my organization, Legal Network, as well as other advocates and community members, are hoping to have the law changed. So we'll address that later on in the presentation, but thank you for that question. So let's talk about HIV criminalization. What is the law currently? But first, we can talk about some history. And just for the sake of clarity, when I refer to HIV criminalization, what I'm talking about is the application of criminal law in cases of alleged HIV non-disclosure, exposure, and or transmission. So this means that people living with HIV can be charged and sent to jail for not disclosing their HIV status to a sexual partner. So historically, where did this begin? Why did it begin? How did it begin? Started in the late 1980s. The first cases of HIV criminalization were observed in the United States. And initially, how it came about, it was through these charges of aggravated assault or attempted murder. And then over time, it became turned into or transformed into these HIV-specific laws to prosecute cases of knowing transmission. And I guess we have to stop and consider the context. When were these laws passed? In the late 1980s, and so much has changed since then. These laws were passed at a time when very little was known about HIV, including how HIV was transmitted and how it could be treated. There weren't the same treatment options that there are today. And they were also misguidedly enacted purportedly with the purpose of protecting public health. But we've learned over time that they are actually very harmful to public health efforts. So that's what was going on in the US. In Canada, it was a bit different. There were never any HIV-specific laws that were established. Criminalization and prosecution happened through existing criminal offenses. There was, for a time, an offense in the criminal code relating to venereal diseases, but that has since long been repealed. And the main method of criminalization was through these existing or other criminal offenses. And going back to Mark's point, I guess, is that prosecutions based on poor science have really continued since the 1980s, even though the general scientific understanding of HIV has greatly improved. So we're really lagging in that regard. So currently, it's really unfortunate to recognize that Canada is a world leader in terms of the number of prosecutions in the past 3 decades. When it comes to HIV criminalization, there have been over 220 prosecutions in Canada. And as I mentioned, there's no HIV-specific provisions. So there's no criminal statute in Canada that explicitly and specifically imposes an obligation to disclose HIV-positive status before sex. Instead, that has come from these judicial decisions through the common law. And it has come through other offenses in the criminal code. So this is kind of a list of some of the offenses that are most commonly used. And the number one most common offense that is used is aggravated sexual assault. And the use of sexual assault law in this area of HIV non-disclosure is very specific to Canada. And it's also particularly problematic because aggravated sexual assault is one of the most serious crimes in the criminal code. It kind of adds to the severity of HIV criminalization in terms of the sentences that people receive when they're convicted of this crime. And it also kind of has an even greater negative connotation, which adds to the stigma against people living with HIV. So just to clarify, oh, I think there's another question. Yeah, you also end up on a sex offender registry. That is one of the concrete implications of a conviction for aggravated sexual assault, is sex offender registration, and that is, of course, incredibly stigmatizing, and can stay with a person for decades at a time. And I just wanted to clarify the distinction also between sexual assault and aggravated sexual assault is that aggravated sexual assault means that a sexual assault occurred which endangered the life of the victim. So in law, the thinking is that untreated HIV could endanger the life of a person. So yeah, just to clarify again, why is it under sexual assault? What is the thinking? What is the rationale or the logic that the courts have used? So ordinarily, you would have consent, you would have sexual activity, and that would give place to a consensual sexual encounter. Now, the law and the courts have decided or established that if you don't tell your partner your HIV status, that is considered fraud. And that fraud invalidates the partner's consent to sex. So essentially, the partner is saying, if I had known that you had HIV, I would not have consented to sex. So my consent was invalid. And in that case, sex which occurs, with fraudulently obtained consent becomes sexual assault as a matter of law. And then it becomes an aggravated sexual assault because the law considers that untreated HIV can endanger the life of a person. And I think it's also worth mentioning that non-disclosure is treated the same in law, whether it's through misrepresentation of your status, whether it's through an outright lie, or whether it's through omission. The person didn't ask you, you didn't tell them. That could be treated the same as if you outright lied and said, no, I don't have HIV, and you did. So that's also problematic in terms of treating different behaviors with the same level of moral culpability or blameworthiness. So let's talk about when is HIV disclosure legally necessary. So this has come about through some decisions from the Supreme Court of Canada. The legal obligation around HIV disclosure was first established in 1998. And at that time, the court ruled that people living with HIV have an obligation to disclose their status to a sexual partner before sex that poses a significant risk of serious bodily harm. And then in 2012, in this case, R.V. Mabior, they clarified what that meant even further. They said that there's a significant risk of serious bodily harm when there is a realistic possibility of transmission of HIV. So let's step back for a second. Disclosure is not required in every circumstance to every sexual partner. It's only for sex where there is a realistic possibility of HIV transmission. And that becomes the key, the crucial question. When does the law consider there is a realistic possibility of HIV transmission? So in that 2012 court decision, the Supreme Court had a very narrow decision. They said there's no realistic possibility of transmission if a condom is used, and this is super important, and the condom is used in conjunction with the HIV positive person having a low viral load. So low viral load is not the same as suppressed viral load, it's a bit higher. And in that specific scenario, when those two elements are present, condom use and low viral load, the court said, okay, there's no realistic possibility of HIV transmission, and therefore there's no duty to disclose. And that counts for both vaginal sex and for anal sex. Now, that's problematic for many reasons, but we can kind of unpack why that is. The science we now know. Oh, I think there's another question. How about for oral? There you go. That's the question. What about those other circumstances, other kinds of sexual encounters? The court wasn't very clear. They said condom use and low viral load, no realistic possibility of transmission. Whereas the science has long established that a condom use on its own, if it's properly used, negates the possibility of transmission, and a low viral load or a suppressed viral load on its own negates the possibility of transmission. But the court did not go that far. They didn't go as far as the science had established, what the science was around transmission. And they also kind of left it unclear or kind of left it ambiguous about those other cases. So moving on from that 2012 court decision, a lot depended on how prosecutors and other courts interpreted the evidence to determine whether or not in any given case there was a realistic possibility of transmission. At that time, the court did leave the door open. They said the law could evolve in the future, depending on the medical and the scientific knowledge around HIV transmission. So it wasn't set in stone forever that the standard would be condom use and low viral load. But they left the door open, they left it kind of unclear, and then that means that the law will develop inconsistently or not in the same way across the country. So we'll get to that later. But first, I want to see if there are any more questions around the state of the law currently, or the state of the law as it was established in that decision, because I'll explain further how it has evolved since then. Is there a certain amount of time they need to have a low viral load to not inform a sexual partner? I had thought it was 6 months. Yeah, so that is something that has come about since then. There have been certain court decisions in certain provinces where they have said, okay, if you have maintained a low viral load, usually it's 4 to 6 months, depends on the province. Sometimes it can be up to 6. In that case, there would be no obligation to disclose, even if condom was not used. Karen asked, is it being applied the same in every province? No, and again, that is part of the problem of how the law was established, how it's been interpreted through these judicial decisions. It means that it is being applied differently by different prosecutors in different provinces, and then there are different decisions being rendered in different provinces that are contradictory, that don't align. And so it makes it hard for people living with HIV to know, okay, what is the law here in this province? If I move to a province next door, do my obligations change? And concretely, as of 2023, the state of the law as it is, yes, there are different obligations depending on the province you're in. So that is not a good thing. It leads to a lack of clarity, a lack of consistency in the law, and it makes it more onerous for people living with HIV. Okay, so I wanted to address some of the science. So what does the science say? So we know that laws and prosecutions targeting non-disclosure have not evolved or not always been guided by the best available science. They haven't evolved to reflect advancements in treatment or knowledge about HIV transmission, and they're really influenced by persistent societal stigma and fear associated with HIV. So a lot has changed in terms of the science since 2012, since that Supreme Court decision. Or at the very least, a lot has become even clearer. There have been 2 scientific consensus statements, one in 2014 in Canada and another one in 2018 internationally, where these leading scientific experts in the field of HIV saw what was going on, and they were concerned about, the criminal law being used in an overly broad fashion against people living with HIV, and that happening because of a poor understanding of the science of HIV and its transmission. So they wanted to set the story straight and be like, no, this is what the actual science is. This is what should be guiding prosecutors. This is what should be guiding courts in their evaluation of these cases. So what these statements did is they addressed the per act possibility of transmission through different forms of sexual acts. There was a lot of research and analysis that went into this, and the conclusions was that for these 5, let's say, sexual acts or behaviors that are listed on the PowerPoint, the possibility of HIV transmission was none to negligible. So we have condom use plus low viral load. That was acknowledged by the court in 2012. The scientists confirm the possibility of transmission is none or negligible. And negligible is like incredibly low. Yeah. Suppressed viral load on its own. So suppressed or undetectable on its own, U equals U, that's enough. We know that. In the science, it's very clear. Condom use alone. Again, there's a caveat, a properly used condom on its own is 100% effective against HIV transmission. And then oral sex, also none to negligible in terms of the possibility of transmission. And finally, biting or spitting, also no chance of transmission. And these consensus statements, they also address other means of reducing transmission that these scientists felt should be considered by courts and aren't always being considered by courts. So you have stuff like taking PrEP or the availability of PEP. So PrEP is a medication that is taken preventively, usually every day, but there are other forms as well by people. And if you take it properly as prescribed, then there is zero risk of transmitting HIV, even if you have sex with a partner who is positive. PEP is used post-exposure, so that's in the event where you believe that maybe you've been exposed to HIV, you take that within 3 days, and that also drastically reduces the availability, the possibility of transmission. And then just generally, the availability of treatment of antiretroviral therapies, the impact that that has on people's lives, the people living with HIV who take this treatment, their life expectancy is practically equivalent to the life expectancy of their HIV negative counterparts. This treatment has really revolutionized what it means to live with HIV in the year 2023. It turns it into a chronic, manageable health condition. And that's the kind of, these are the scientific facts that we want courts and prosecutors and actors in the justice system to be aware of, because right now they're being informed by these misconceptions that exaggerate the harms of HIV infection. I see there is a question. Has there been any argument that because external and internal condoms are not rated for anal sex, that it would not apply within that type of sex? So these scientific consensus statements do acknowledge that the differences between vaginal and anal sex, but nevertheless, the possibility of transmission when it comes to properly used condoms for anal sex is none to negligible. So it would be the same standard. Okay, so yeah, the main takeaway again, the law has not caught up to the science. And the criminal justice system's understanding of transmission risk is really key in determining the scope of criminalization of people living with HIV. If a judge has a misguided view of how easy it is to contract HIV, then that will influence what they consider to be a realistic possibility of transmission, and that exposes people living with HIV to a greater risk of criminalization. So yeah, the law not currently in line with the leading science. The legal standard is wider. It captures more behavior that the science clearly states does not expose people to the possibility of transmission. And yes, it's also really important to highlight that currently people are being criminalized even if they have no intent to harm their partner, to transmit HIV, even where the risk of transmission was low or non-existent, and even when HIV was not actually transmitted. So that is, again, a big issue. And then we've discussed this already a bit, but the legal standard varies according to the circumstances of the sexual encounter, but also depending on the province, depending on different court rulings. So you have this one standard that was established by the Supreme Court, which applies to all of Canada: condom plus low viral load, no legal duty to disclose. But then in some provinces, it goes further. For instance, in Nova Scotia, in Ontario, there have been some cases where they have acknowledged that either a condom or either a low viral load is enough on its own, where we know there's no realistic possibility of transmission and therefore no duty to disclose. But yeah, again, there's an inconsistent application of the law across Canada that makes it unclear. It makes it hard to know what the legal standard is. So why are we concerned? I think it might be dawning on you already some of the reasons why this is incredibly problematic. The law is not at odds with the medical evidence on the impact of viral load in condoms on HIV risk of transmission. We're seeing criminalization in cases where there was no intent and no actual transmission. And I really want to hammer this home. The majority of cases in Canada where prosecution occurred, there was no actual transmission of HIV. So just generally, compared to other communicable diseases or infections, HIV is being singled out. And that comes from a history of stigma. And it comes even though cases of intentional, actual HIV transmission are incredibly rare. And yeah, it doesn't take into consideration the challenges or the difficulties, the complexity of disclosure. People who live with HIV, around disclosure, there's risks of violence. There's fear that they'll be ostracized, that they'll face blackmail or harassment, that their sexual relations, their sexual or their romantic relationships might break down if they disclose their status to their partner. And for women living with HIV especially, it becomes even more difficult to negotiate safer sex, or they disclose their status and they fear violence. So either they have the safer sex, or on the other hand, they face violence. Or sorry, that's poorly explained. Either they have unprotected sex without a condom, and they face violence if they try disclosing their status, or vice versa. So that's very challenging for them. And then the law has disproportionate impact on certain communities. So the communities, the people who are most affected by HIV, first of all. So gay, bisexual, and men who have sex with men, Black and Indigenous people in Canada. And those people are then disproportionately impacted by HIV criminalization. And I also wanted to highlight something that I have on the slide about, we need to also think about who has access to treatment, because yes, treatment in theory is available to everyone in Canada, but there are still issues around accessibility, around adherence to treatment, and which communities have those challenges related to accessibility, and what that means in terms of achieving a low viral load and their future risk of criminalization. Let's see a Q&A. Gatekeeper. Yeah, I don't know if Mark wants to expand on that, but if not, I will move on to the impacts of criminalization. It's very clear criminalization is incredibly harmful in a lot of different ways. So number one, if a person doesn't know they are positive, they can't be found guilty of non-disclosure. So this leads to a kind of perverse incentive for some people. It dissuades them from getting tested. If I don't get tested, I don't know my status, then I won't be prosecuted. That's not good for public health purposes. Then criminalization impedes, open, transparent communication with health professionals, because people may fear that these health professionals will be called as witnesses in a potential prosecution or trial against them. And that can in turn affect, whether or not they participate in counseling, whether or not they follow up with treatment, whether or not they follow up with their doctor's visits. And fundamentally, it affects their right to privacy with respect to confidential and sensitive medical information. Okay, I see Mark has expanded. gatekeepers controlling the message, the facts, and not informing people living with HIV as an expansion, frontline healthcare, and others are problematic. Yep, that's very true. And yeah, that goes into issues surrounding stigma and discrimination against people living with HIV. It's an issue when we treat a personal private health matter as a crime. It leads people living with HIV to fear prosecution for who they are, for their status. It leads them to fear that their status will be used against them by sexual partners. And it really just undermines their rights. It contributes to stigma, and it leads to misinformation. This is a big one. I think we need to consider how the law being so out of step with the science sends a message to the public. It tells them that the risks of transmission are greater than they actually are. And it also tells them that the consequences of HIV are far worse than they really are. I don't want to minimize the consequences of HIV in any way, but the law being this expansive means that it kind of fails to acknowledge that in this day and age, HIV can be treated and kept under control, and people living with HIV can lead, very long, healthy, productive lives. A very important point is that it does not improve public health outcomes. We have, a lot of research that's been done in this regard. None of the evidence demonstrates that criminalizing HIV, has a HIV prevention benefit. It's actually the opposite. Criminalization and public health don't go well together. The criminal law is really too blunt of an instrument to achieve the goals of public health. And if you have people who aren't getting tested, who aren't following treatment, who have misguided ideas about how HIV is transmitted, well, that's terrible for prevention efforts. So it's really counterproductive in that regard. Exacerbates injustices. We've spoken about, the disproportionate impact on certain communities. HIV criminalization really is marked by discrimination and racism, both in prosecutions and in terms of sentencing. And it's the marginalized communities that are being most affected. And then finally, we've spoken about this as well, but aggravated sexual assault has very harsh sentences in terms like the maximum sentence is life imprisonment. And then we've mentioned sex offender registration, which is incredibly stigmatizing, long-lasting consequences. And what's really mind-boggling is there's been, studies that have shown that the average sentence given for HIV non-disclosure is worse than for cases of sexual assault involving forced or coerced sex. That is mind-boggling to me. It makes no sense. All that being said, there have been some modest advances in the past few years that I want to highlight. First of all, you can see from this table in the past, decade or so, there has been a steady decrease in the number of cases that are coming forward, and this comes, from a number of reasons. Generally, maybe a growing awareness among law enforcement, among courts, among prosecutors, around the science of transmission, around HIV science generally. It also comes, from stuff like the Minister of Justice recognizing and publicly acknowledging, the issues surrounding overcriminalization, stating very clearly that the law in this area is overly broad and it's punitive. This has happened under the current Minister of Justice, David Lametti, but also previously his predecessor, Jody Wilson-Raybould. Now, the third point is again, very promising and is a good step. The fact that many courts, or some courts around Canada have recognized in law that an undetectable viral load on its own is sufficient to say there's no realistic possibility of transmission and therefore no obligation to disclose. The issue, though, is that there isn't yet a binding decision for the country as a whole, so it's not fully settled law across the country. I mentioned earlier Nova Scotia Court of Appeal stated there, they recognize in law U equals U. That's great, but across the country, it's not the same. And we're still waiting for the same, recognition from courts around condom use on its own or around oral sex. So at the moment, people who don't have a low or suppressed viral load are still being convicted even if a condom was used, despite the scientific consensus that goes against that. And there's still not yet been definitively decided across the country whether there is a legal duty to disclose before oral sex. So the risk of prosecution in that case remains as well. Mark asks, this law is unlikely to change until someone is charged and fights back in court. Is this accurate? Yeah, that's very accurate. And that's part of kind of the problem. When you have a system like the common law, which is all about, individual decisions changing, evolving the law, developing the law, that means that the law changes very incrementally, very slowly. And litigation is very time consuming. It is also, very challenging for the people involved. It takes a lot out of them. So for relying on litigation or cases to eventually move the law forward, that's going to take a while. And until then, there's going to be, damage caused by criminalization. So that's where I'll get to the next steps that we are advocating for, which is law reform, changing it at its source, going to the criminal code. But before that, I wanted to address some other points. Another area of progress is at the prosecutorial level. So essentially, you have directors of prosecution in all the provinces and at the federal level for the territories. And they have the power to issue directives or policies or guidelines about what cases they want to prioritize or what cases they choose to pursue, how they want to handle prosecutions. Now, those documents, those guidelines, those policies, they don't have the same force or value as a law or a court decision, So it's helpful, but it's not as helpful as like something more concrete, like a law change. So yeah, federally, we have a prosecution service which deals with federal crimes, which are very specific, and I won't get into, but they also prosecute crimes in the 3 territories. And yeah, in 2018, at the federal level, there was a new directive that came into effect, and that said we will not prosecute in cases of suppressed viral load, which is good news, and we will generally not prosecute in cases of condom use, oral sex, or when a person is on treatment. So again, it's better than nothing, but you see that it's like a middle road. We're not going fully in line with the science, what the science tells us. Provincially, there have also been a few formal official policies which limit prosecutions for HIV non-disclosure in Ontario and in BC in particular, but they don't go as far as the federal guidelines. And then in Alberta, there's no official guideline or directive, but there is what's called an instruction. So essentially the Assistant Deputy Minister of Justice, who's in charge of these prosecutions, has instructed or advised provincial prosecutors in Alberta to not prosecute people who had maintained a suppressed or undetectable viral load at the time they had sex for at least 4 to 6 months, whether or not a condom was used. So in Alberta, under this instruction, if you have a suppressed or undetectable viral load for at least 4 to 6 months, no legal obligation to disclose, even if a condom wasn't used. But unfortunately in Alberta, again, it doesn't go as far as the federal directive. It doesn't mention condom use on its own, and it doesn't mention oral sex on its own. So all things considered, generally these policies, prosecutorial policies, are a good thing. But the issue again is that these directives kind of create different standards for prosecutions of HIV non-disclosure across different provinces, which again results in inconsistent application of the law in Canada. It leads to a lack of clarity for people, and that is not great. So let's talk about the next steps. People living with HIV and human rights advocates have spoken out against criminalization for years now, and they've pursued many strategies to kind of mobilize communities to advocate for change in law, in policy, in practice. And in 2017, the Canadian Coalition to Reform HIV Criminalization, which I'll refer to as the Coalition, determined, okay, criminal code reform is the way to go. It's an important and it's a necessary part of the solution to the problem of criminalization because, as I've mentioned, prosecutorial policies can only go so far. And again, as we've mentioned, incremental change through court decisions will lead to uneven application across the country. And it's just a time-consuming way to achieve change. Whereas going to the source, amending the criminal code, that would solve the, or, hopefully resolve the problem. It would bring clarity and consistency in the law, and it would limit the harms of criminalization. So the coalition, what they did in 2021 to 2022, they did several months of community consultations to kind of develop a consensus around what we wanted the government to do in terms of criminal code reform. So there was years of deliberation that preceded that as well, consulting across Canada with communities that are directly affected by HIV criminalization, people living with HIV, people working in the HIV sector, lawyers, researchers, activists were all consulted. We came with that consensus. And then in 2022, the federal government, Minister of Justice David Lametti, announced that the government was going to review the law around HIV non-disclosure, seeking again additional input from stakeholders and the public on possible reforms, basically repeating the work that had been done by the coalition. And this came to a close in mid-January. So where are we now? Justice Canada is reviewing the results of the consultation. The government is deliberating about some different law reform options, and we hope that a bill will be introduced in Parliament soon. But when it is introduced, it will have to go through many steps. The House of Commons, there's a committee study, there's different readings and votes, and then it has to go to the Senate, more committee study, reading, vote. It's a long slog. It may take a long time, and the clock is ticking with, the current Parliament. So we're hopeful that, to get something done in time, but we also need to keep our expectations measured. And I want to move on now to give you an idea of what we are asking for, what is in this community consensus statement, what do we want from the law reform. So this is a consensus endorsed by more than 100 organizations across the country. There are 4 main asks, but the overarching goal is really to end the overuse of criminalization and to align the law with the science. So number 1, remove non-disclosure from sexual assault law. We argue it's not the right categorization for HIV non-disclosure. There are many feminist scholars who agree with that. They say it distorts the law of sexual assault. It's not the same. Allegations of HIV non-disclosure are not the same. They're not equivalent to sexual offenses involving coercion, force, and violence. So they shouldn't be treated the same. And what we say is that in exceptional cases where prosecutions are pursued, they should keep it under existing criminal offenses that are non-sexual, and they should not create an HIV-specific offense, because that, we would say, would increase stigmatization once again. Now, moving on to the second point, criminal law should only be used as a last resort. We should limit prosecutions to dealing with those very, very rare cases where a person knows their HIV status, acts with intention to transmit HIV, and does in fact actually transmit it. Because currently a person could be, acting responsibly, taking precautions, have no intent to cause harm, they could still face criminal charges, and that is not okay. Thirdly, currently non-citizens who are convicted of HIV non-disclosure face deportation. That's really like a double punishment. It has a racist and discriminatory impact, and we argue that HIV non-disclosure should not affect a person's immigration status. And then finally, there should be a way for past convictions to be reviewed, for conviction to be expunged if it doesn't fit within the new limitations on the scope of criminalization, so that people living with HIV no longer live, with the label of being a criminal or a sex offender.
Andre, can I ask, sorry, I can't type into the chat.
Yep.
What's the representation of prosecutions right now from racialized groups compared to others? Like, is there a disproportionate rate?
Yes,
Yeah.
absolutely. So I would say I don't have the exact statistics, but men of color are especially overrepresented in prosecutions and in terms of convictions. Migrant communities are also overrepresented. Indigenous women are overrepresented compared to other women. So there's definitely a racialized impact in terms of prosecutions and in terms of convictions. Yeah. So here are some of the main takeaways that I want to convey in this talk. The current legal standards are unscientific, they're unclear, they're inconsistent across the country. It leads to a situation where people living with HIV are being convicted of serious criminal offenses, they're being sentenced to prison, even when there's little to no risk of transmission, even when there was no transmission. HIV criminalization is super harmful. I've mentioned, it doesn't help with public health. It also leads to misinformation, gives people a false sense of security that the law will help them. It contradicts the message about, sexual health, autonomy, and responsibility, and it increases the stigma and discrimination faced by people living with HIV. So what we need are really measures that create a safe environment, that support people, enables them to seek testing and treatment, to safely disclose their HIV status if they feel comfortable, and to do so free of stigma and discrimination. We don't need a punitive approach. That only hurts. It doesn't help. So finally, what can you do to help? So first of all, you can educate yourself. You can learn about these issues. They're complicated. It's hard. It's not easy, but you're already doing your part by being here. You can look up the HIV Legal Network and our work on these issues. You can also look up the coalition and its work, its demands. They have a website with a lot of information. You can learn, what do community members and advocates want? What are their specific demands for law reform? Then you can talk to family and friends. I think a big part of combating stigma requires raising awareness. It means educating people who might not have exposure to these issues. It means, really reminding them or informing them of the harms of criminalization. And then, related to the law reform efforts, contacting your federal MPs will become very important, whether it's phone, email, letter, make your voice heard, especially once a bill is introduced in Parliament. I think it's very important to show our politicians that people care about these issues, that they disagree with the current state of the law. This might not necessarily be a popular issue for politicians, so we need to show them that it's worthy of their time and of their efforts. So I see there is a question. Are there any statistics in regards to HIV rates and transmission in terms of the two-spirit or trans population? Yes, so I mean, trans populations are also disproportionately impacted by HIV in Canada. I'm not sure though about HIV criminalization, how impacted they are, but they're definitely a population which is disproportionately represented compared to the general population. And then in the chat, okay, the survey is available there. So I will, and then yes, there's a note about organizations being able to sign the community consensus statement. And I wanted to leave you with some resources. You can go to our website, hivlegalnetwork.ca. There's a section on criminalization. And then info sheets, briefing papers, there are videos, films. You can look at the coalition website, the CCRHC, hivcriminalization.ca, also a great source of information. Yeah, Mark makes a great point. The challenges that this creates for people living with HIV, so that they're not then accused of non-disclosure, dishonestly by people. The evidentiary burden that falls on them, it's really terrible. So just final slide. Thank you very much. I am happy to take any more questions. I don't know if this ends at 1 p.m. on the dot, but we have time. And then the QR code leads to the survey. There's also the link to the survey that would really help me and help us improve our public educational work and make sure that we respond to your needs. So thank you very much.
Thanks so much, Andre. And I'll be sending an email out also to all the registrants as well with the survey link. I know some people can't click it in the message, so I'll make sure that people get that. That was really informative. I think there's one more question here. Oh, no. I don't know if anybody has anything else to say, but we'll stop the recording now. And if people have more questions, they're welcome to stay. But thank you so much, Andre, for sharing this information with us.